Hello everyone, I'm Dr. Aditya Sai. Welcome to our channel of the Shoulder and Knee Clinic, where we discuss common issues pertaining to the shoulder, knee, hip, elbow and various sports injuries. So we'll discuss about a very common problem of the shoulder separation or acromioclavicular joint injuries. So what is this condition? So essentially, if you see your shoulder, above this ball and socket joint, there is another joint called the acromioclavicular joint between your collarbone and your shoulder blade. So all your load transmission that happens from your shoulder to your axial skeleton is across through this joint. The joint is lined by a capsule in all directions, and this end of the collarbone or the clavicle is stabilized by the ligaments here. Typically this injury happens when individuals fall on a point of the shoulder like this. So most of these injuries are seen in biking injuries or cycling injuries. Typically there is pain, swelling. The outer half of the collarbone appears to be more prominent. So immediate treatment is with ice application and immobilization of the shoulder. You should meet an orthopedic surgeon or a sports injury specialist or a shoulder surgeon if you have suffered this injury. They may advise an X-ray or an MRI to assess this injury further. So on the X-ray we can see the significance of the increase in the distance between the distal end of the clavicle and the acromion. An MRI may be done to assess any other associated injuries, because in around 30% of the injuries there are further injuries in the shoulder which can be assessed. Now treatment for this depends on the duration of the injury, whether you are coming within the first 3 to 4 weeks of the injury or you are coming more than 6 weeks after the injury, the degree of the injury which can be seen on the radiograph, your activity level. So these are the factors which decide the further treatment. So let's say it's a grade 1 or 2 injury. So there is a classification called Rockwood classification by which an orthopedic surgeon can grade this injury. So let's say there is a grade 1 or 2 injury. So majority of these cases can be managed non-operatively with immobilization for around 3 to 4 weeks, and then with physical therapy individuals regain good function of the shoulder. It is above grade 3B Rockwood injuries that we need some form of a surgical intervention. So in an acute scenario, generally a keyhole surgery or an arthroscopic surgery can be done. So essentially the crux of the problem in this injury is this part of the collarbone has gone up and the shoulder has sunk below. So essentially in the arthroscopic surgery, this end of the collarbone is brought down and a button is fixed below this bone called the coracoid and a button above the collarbone. So this stabilizes the joint and the ligaments are allowed to heal. This is only for acute injury. In chronic injuries, let's say more than 4 weeks or 6 weeks, doing just this procedure doesn't. In these scenarios, what is done is one of the tendons from your leg is harvested, and in addition to fixing with the button, the tendon is used to reconstruct the leg. So that is called acromioclavicular joint reconstruction. In an acute scenario, what we do is acromioclavicular joint repair. So there is a significant difference between them, because after 4 weeks, the ligaments, the native ligaments don't have a healing potential. So if you are afraid that you don't want a more significant surgery where something is taken from your leg and put there, then you should consult a shoulder specialist before till it goes to that. Yes, you do recover good function in the shoulder after both this, but in chronic scenario, tendon augmentation is required. So both surgeries, whether it's in an acute scenario or a chronic scenario, can be done arthroscopically and have very good results. Typically, the next day of the surgery, you can be discharged. You can start using your hand for writing, typing and those activities, but lifting your hand is not allowed in the first 4 to. Generally, it takes around 3 to 4 months to have a full movement as well as strength in the shoulder to place. There is another scenario in elderly individuals, let's say 70 plus, who have a high grade Rockwood injury. So in those individuals who are not looking to do a lot of stuff, who are not concerned about the cosmetic aspect that the distal end of the clavicle has become more prominent, it can be managed non-operatively, although the risk of a non-operative chronic pain in the back. So if this injury is not addressed surgically, there is always a risk that the way the shoulder blade moves, what we call as a scapulohumeral rhythm, it gets disturbed and you can have chronic back pain. But since elderly individuals have low demand, we can manage a lot of these injuries non-operatively in elderly individuals. In younger individuals, for a high-grade injury, always a surgical treatment is better. So thank you for watching the video. If you like what you saw, then share, like and subscribe to our channel.